Implants are a method of replacing missing or severely damaged teeth. An implant is a metal rod made of titanium which is fixed into the jawbone. The implant bonds and integrates with the living bone to provide a firm support for one or more replacement teeth. Replacement options include highly crafted porcelain crowns and bridgework, as well as dentures. Implants provide a long-lasting, stable and aesthetically pleasing option for tooth replacement. The procedure is straightforward and safe, although it is important to plan the treatment carefully. Implants have been used successfully since the early 1960s and have a good and long safety track record. Their use is becoming increasingly widespread. One of the most important things is to take the necessary time and care planning and carrying out the treatment. Whether a patient is suitable for implant treatment largely depends on the state of the bone in the jaw. Your dentist will use several tests to check the amount of bone in the area to be treated and how healthy it is. If there is not enough bone or it isn't healthy, then it may not be possible to place an implant without first transferring or grafting some bone onto the area. How many implants you need depends on how many teeth have to be replaced and how they are going to be restored with artificial teeth. You can replace everything from a single tooth to a complete set, and you don't necessarily need one implant for each missing tooth. Implants take a fair amount of time to complete. You will normally need a number of visits to the dentist to prepare for the treatment. After fitting the implant or implants, it can take 3 months for the lower jaw and up to 6 months for the upper jaw for healing and the bonding with the bone. It is common practice to allow time for this before fitting replacement teeth. You don't need to worry about there being a gap during healing. The dentist can fit a temporary restoration or modify your dentures so you can wear them during the healing period. From the first consultation to the day you have your restored or artificial teeth finally fitted could take up to 12 months. It largely depends on the exact requirements of your individual case, how complicated it is, and the preferred technique of the dentist. Your dentist will give you your own specific timetable. The implant procedure requires a small surgical operation, which normally is either carried out in your own dentist's surgery or at a dentist who specialises in implant surgery. The surgery is commonly done under local anaesthetic with some sedation. The procedure may, in some instances, require the removal of a tooth. It is often necessary to fold back the gum to reveal the jawbone in the area where the implant is to be placed, insert the implant and stitch the gum. The actual procedure is painless thanks to the anaesthetic, but you may well experience some discomfort in the week following the surgery. An analgesic like aspirin or paracetamol is usually prescribed to relieve the pain during the healing process. Your dentist will give you further advice on pain relief or any concerns you may have. Once your treatment has been thoroughly planned, the surgical procedure results in the placement of the implant or implants into the bone. The surface of the implant is made in such a way as to encourage bone growth around itself. Once healed and integrated into the bone, the implant provides a good, solid fixture on which to place the crafted tooth restoration. Once the restoration work is completed and the tooth replacement carefully finished, you need to look after replacement teeth and keep them clean, much like you do your natural teeth. Cleaning the teeth attached to the implants is generally no more difficult than cleaning your other teeth. If there are any tricky areas, your dentist will suggest effective ways of dealing with them. Most artificial teeth secured by implants can only be removed by your dentist. If you have partial or complete dentures fixed to the implants by bars, then you can remove them for cleaning. The success rate for implants is around 90%. In the very rare cases where the bonding doesn't work, in other words, the implant becomes loose during the healing period or just after, then the implant is simply removed and the area left to heal. Once healed, it is fine to repeat the treatment. Some dentists carry out implant treatment themselves in their surgery, but commonly your dentist will refer you to a specialist for assessment and treatment. For instance, the specialist may perform the surgery while your own dentist arranges for the replacement teeth to be made and fitted. Implants are not cheap. A great deal of time and expertise goes into the successful completion of the treatment. However, looked at in the long term and considering the life of implants compared to other tooth replacement options, they do work out as good value. They also avoid the need to alter healthy teeth to provide support for crowns and bridges. Over 90% of modern implants last 15 years or more. Their life expectancy also depends on the quality of bone into which the implant is being placed. Your dentist's initial tests will give a good indication of this. Implants generally result in very natural-looking restorations with which you'll feel confident. They also tend to function extremely well, so eating and speaking should not normally be a problem. In other words, well-constructed implants look and feel pretty much as natural as your real teeth.